So join us as we dive into something interesting, but sometimes gives mixed feelings about hospital.
Yeah.
And that's the issue of test results of patients. So on many occasions, I've met with patients who have been to several hospitals. So these patients have been to several hospitals, they've done a variety of investigations, and then I see them. I ask, oh, what have you done so far? I've done this, I've done that. So where are the test results? They're like, they're in that hospital. Like, they're in that hospital. So go back to the hospital and continue your treatment. No, we don't want to continue our treatment in the hospital. So we came here.
And there's no referral.
And there's no referral.
There's no referral. Let's even say you want to use word of mouth. They don't even know what the result says.
They don't know what the result is. They don't know what the result is. And then they're in front of you and
like beginning again.
Yeah, it's a big problem. It's a big problem. So we just want to discuss very briefly and come to a conclusion, and we want you to know how you're supposed to manage such circumstances. So what do you think?
I usually wonder if hospitals think that those results actually belong to them.
Okay.
Because I don't see a reason why someone would have done a test, paid for a test, and they don't have access to it. In fact, many times they don't discuss the results of those tests with the patients. I know there's also complacency sometimes on the part of our clients or patients. They seem to be disconnected, so to say, even in their own care. But that being said, I feel if someone has used their money to pay for an investigation, or insurance paid for an investigation, or whatever it is, it is the person's property and they should have access to it. Yes, for safekeeping, the hospital needs to have a copy of that investigation, but the patient also has the right to have a copy of that investigation, having been told about what is in that investigation. In fact, do you know, in bigger clients, and not even bigger clients, it's with us, patients should have what we call patient health record, PHR, which is part of the electronic medical record. So that if they peradventure they want to leave a facility and move to another facility, they have access to all their medical records on their electronic device or whatever. It's their right. I feel it's their right to have access to just those investigations. Well, some hospitals add under the fact that they use electronic medical records, and there's no way of providing such results to the patient. I think it's just an excuse. I work in a facility where we use electronic medical records, but we still are able to print out, or you can even transfer the results to the patient's email or something. But the ideal thing, or the best, would have been a patient health record. They have access to their treatment so far, their diagnoses and investigations.
All right. So the way I look at it is this. There are many reasons why patients may actually not have those records. One, they might not have asked for it.
That was why I mentioned the complacency.
Yes, so they have not asked for it. The hospital does not routinely give the results out. And
they just assume this person is going to be with us forever.
Yes, and they expect you to come back, but you did not go back. So in some of those situations, it's just not the hospital's fault.
Yeah.
All right. So that's one. Two, some hospitals actually have mechanisms by which they send the results generally to people. So when you register for investigations, they take your email and they just tell you, we're going to send it to your email. But along the line, there can be errors and they end up not sending it to you. That's probably just a clerical error. Hospitals also sometimes are particular about privacy. You mentioned that they feel, oh, let's be careful when we are releasing results out. However, my own summary of what it should be is every patient should have access to their investigation results. I'm not saying their documentation. You document in the hospital. I'm not saying give all the documentation to the patient. No. We're
Yeah, the
saying
patient health record actually doesn't, is not there. Some things have been edited out, but it's a comprehensive
it's like
write-up about
it's
a
like
patient.
summary.
Summary
A
about
summary,
a patient, and they have access to it and they can take it anywhere they want to go.
Yeah. But the key here is there's always a way of making sure you as a patient have access to your results.
Yes.
Number one, you must ask. If you don't ask, you cannot say that it wasn't given to you, because it might not be routine. In some places, you might need to ask. And I'm sure if you ask, it should be given to you, except when you go to a cult hospital.
Another smart way actually is to ensure that you have a photocopy in places where paper system is still being used. You do a photocopy of the result before you hand it over.
Yeah, so in fact, this is what I do routinely. When I consult and the patient brings in paper, of course, I consult sometimes places where they don't use the EMR, and sometimes they use the EMR. So when there's no EMR, what I tell the patient is, okay, I've seen your result. You should have a documentation. You should have this result. So do you want to make a photocopy, or do you want to snap it on your phone?
Yeah, that's another way of doing it.
So you snap the result and have it on your phone, because sometimes people don't even like carrying papers around, but once you have it on your phone, you put it in your mail, it's safe.
And have a folder, not that you'll be looking up and down for it when you need it. Have a folder for your medicals.
If you are in a place where it is EMR, the electronic medical records that are being used, you can also snap the investigation result page. So we open the page for you, snap it, it's on your phone, you have access to it. So anytime anybody is saying, oh, what were you treated for, you won't start cracking your brain and saying, oh, I don't know. What investigation have you done? I don't know. Very easy. The hospital should not reject you asking for the investigation. Women do ultrasound scans in pregnancy, and you ask them later on in pregnancy, what were the findings? Ultrasound scan, and they say they don't know. Where's the result? We don't have it.
They don't have it.
So
what do you want the other doctor to work with? And there's no referral.
Right. So summary, you should have your investigation results.
Yeah. And that's it.
Bye. See you next time.
Bye. So if not subscribed, you've not clicked the notification bell, and we're making all these videos for you, what are you waiting for now? Please subscribe, click on the notification button, and share.